Hello, I am Dr. Elia Jones, obstetrician and gynecologist. I understand that, like many young women today, you sometimes use marijuana. I also understand that you are not interested in becoming pregnant right now. However, sometimes you have sex without using a long-acting reversible contraceptive. Not many women realize that long-acting reversible contraceptives such as IUDs and birth control implants are far more effective at preventing pregnancy than birth control pills, condoms, or skin patches. You may be wondering what that has to do with using marijuana. If you are having sex without an IUD or implants, you might get pregnant, and most women don't realize they are pregnant until 4 to 6 weeks later, when they've already missed their period. If you smoke marijuana during that time, you may be putting your baby at risk. Sometimes women don't know what to think about marijuana. On one hand, most women are used to hearing all kinds of terrible things about weed that just simply aren't true things. Like everyone who uses it becomes addicted. Because of this, they ignore all the warning signs about it. On the other hand, some women have also heard that marijuana is completely safe and that because it's natural, it can't possibly do any harm to anyone. So which one is it? New research shows that the truth is somewhere in between. The risks of using marijuana aren't nearly as bad as some people used to think. However, if you were to accidentally get pregnant, your baby would be healthier if you stopped using weed. So, the bottom line is, if you are having sex and not using an IUD or implant, you may want to stop marijuana. As you consider your options, there are two things you should know. First, IUDs and implants are the most effective types of birth control. They are more effective than birth control pills, condoms, patches, and rings, and can be put into place or removed by your doctor at any time. Secondly, you cannot see the long-term effects of marijuana with your eyes. Research shows that children whose mothers used marijuana while they were pregnant are a little more likely to have learning problems in school, problems with attention and behavior, later drug use, or depression. If you are not using a safe and reliable form of birth control and you are smoking weed, you might get pregnant and be putting your baby at risk. So, if you are ready to quit using weed or switch to more reliable birth control like an IUD, then great. Clearly, you are someone who wants to be in control of your body. If you are still thinking about making this change, just remember, using less weed or giving it up altogether and using a long-acting reversible contraceptive such as an IUD or implants is the best way to ensure that you are in control of when you want to have a baby and how healthy that baby will be.